Hi, welcome to the Healthy Life channel. Imagine waking up one morning with a mild cough, feeling a bit tired, maybe accompanied by a fever. You think it's just a common cold, but within a few days, your condition worsens. Breathing becomes difficult, your chest feels painful, and your body grows weaker. This is not the flu, it's pneumonia, a disease that claims more than 2 million lives every year. Shockingly, many people don't realize they have it until it's too late to treat. What's even more frightening is that its symptoms often appear ordinary, even resembling mild illnesses we tend to ignore. So, how can you recognize these signs before it's too late? Here are the symptoms indicating you might have pneumonia. 8. Confusion or changes in consciousness. In some cases of pneumonia, especially in the elderly patients, may experience confusion, disorientation, or even loss of consciousness. These symptoms often go unnoticed because they are not directly related to the respiratory system, but they are serious signs that require immediate medical attention. Confusion or delirium in pneumonia is caused by low levels of oxygen in the blood, hypoxemia. The brain is very sensitive to changes in oxygen levels, so a lack of oxygen can affect cognitive function. In addition, high fever or infection that spreads throughout the body, sepsis, can also trigger impaired consciousness. In the elderly, these symptoms often appear before other classic signs of pneumonia, such as coughing or fever. In children, these symptoms can appear in the form of febrile seizures, especially if the fever is very high. Whereas in the elderly, patients may appear confused, unable to recognize people around them, or have difficulty responding to conversations. This often delays the diagnosis of pneumonia, as the main symptoms such as cough or shortness of breath are not always dominant. 7. Fatigue and weakness. Extreme fatigue is one of the symptoms that is often overlooked, but is very common in pneumonia. Patients may feel weak to the point where it is difficult to perform simple activities such as walking or even talking. This fatigue often does not improve despite adequate sleep or rest. The body spends a lot of energy fighting the infection. The immune system is constantly active, and the body's metabolism increases to support this process. In addition, hypoxemia, lack of oxygen, affects the energy supply to muscles and organs. Patients with fever also lose fluids and electrolytes through sweating, which exacerbates the feeling of fatigue. The combination of these factors makes pneumonia patients often feel very tired and take a long time to recover. 6. Skin discoloration, cyanosis. In severe cases of pneumonia, patients may exhibit cyanosis, which is a bluish color to the lips, fingers, or areas under the nails. This is a serious sign that indicates the body is deprived of oxygen. In pneumonia, alveoli filled with fluid or pus are unable to absorb oxygen properly. Hemoglobin that is not bound to oxygen is predominant in the blood, and this hemoglobin has a dark bluish color. As a result, body tissues that lack oxygen appear bluish. Cyanosis is often accompanied by other symptoms such as rapid breathing, dizziness, or confusion. If cyanosis occurs, it is a sign of an emergency that requires immediate intervention, such as supplemental oxygen administration or even ventilator assistance. 5. Rapid breathing, tachypnea. Pneumonia patients often breathe rapidly and shallowly as the body's response to compensate for low oxygen levels in the blood. This is one of the first signs observed in infants and children with pneumonia. Tachypnea is the body's compensatory mechanism when oxygen levels are low, hypoxemia, or carbon dioxide levels are high, hypercapnia. The brain responds to this signal by increasing the breathing rate to try to increase oxygen supply to body tissues. However, breaths that are too rapid often become shallow, so gas exchange remains suboptimal. In infants and young children, rapid breathing is often accompanied by chest retraction, withdrawal of the muscles between the ribs, indicating heavy work of breathing. 4. Chest pain. Chest pain in pneumonia is sharp or stabbing, and usually worsens when coughing or taking a deep breath. The location of the pain often corresponds to the area of the lung that is infected, for example, only on one side of the chest. This pain often discourages deep breathing, which can worsen lung ventilation. This pain usually comes from irritation of the pleura, the membrane lining the lungs and chest wall. This condition is called pleuritis, which occurs when the pleura becomes inflamed due to the spread of infection from the lungs. Any movement of the lungs, such as when coughing, taking a deep breath, or sneezing, increases the friction between the two inflamed pleural layers, causing pain. In addition, persistent coughing can also cause pain in the chest wall muscles due to fatigue. 3. High fever. Fever is a systemic sign of the body fighting infection. In pneumonia, fever is often accompanied by chills, excessive sweating, and a feeling of weakness. The body temperature can reach 39 degrees Celsius or more, especially if the cause is a bacterial infection. At night, patients often experience excessive sweating, which makes them feel uncomfortable and weak. Fever occurs because the body releases substances called pyrogens in response to the infection. These pyrogens signal the hypothalamus in the brain to increase body temperature. The aim is to slow down the growth of microorganisms, as many bacteria and viruses cannot survive at high temperatures. However, fever also increases the body's metabolism, which can worsen fatigue. In children, high fever often triggers febrile seizures, while in the elderly, fever can be atypical or not even appear at all. 2. Shortness of breath. Shortness of breath occurs because the alveoli in the lungs that normally contain air are now filled with fluid or pus, which directly inhibits gas exchange. In patients with pneumonia, shortness of breath can occur even at rest. Patients may feel like they are breathing through a straw or feel tired after walking a few steps. In severe cases, patients may exhibit the use of additional muscles, such as the neck and shoulder muscles, to help breathe. This shortness of breath is the result of a combination of factors. Firstly, fluid-filled alveoli cannot absorb oxygen effectively. Second, inflamed airways are often narrowed, worsening airflow. Third, hypoxemia affects muscle function, so the body is not only deprived of oxygen, but also energy. The body's response to shortness of breath is to speed up the breathing rate, tachypnea, but because the lungs are unable to work optimally, the sensation of tightness remains. In patients with comorbidities such as asthma or chronic obstructive pulmonary disease, COPD, this symptom may become more severe. 1. Cough with phlegm. Coughing is the main symptom of pneumonia. Initially, patients may only experience a dry cough. However, as the disease progresses, the cough becomes productive with colored sputum. The color of the sputum can provide clues about the cause of the infection. Yellow-green often indicates a bacterial infection, while white or clear is more common in viral infections. If the pneumonia is severe or involves lung tissue damage, the sputum may be mixed with blood, which is a serious sign. When the lungs become infected, the body's immune system responds by sending immune cells to the site of infection. This process causes inflammation in the alveoli, so fluid and mucus are produced as the body's response to catch the pathogen. Coughing is a natural reflex to clear the airway. In severe pneumonia, the frequency of coughing often increases, especially at night, which can cause sleep disturbances. In addition, patients often feel pain in the chest or throat due to the constant pressure from coughing. So, now you know how dangerous pneumonia is and how to recognize its signs early on. Never ignore symptoms such as prolonged coughing, shortness of breath, or high fever, as pneumonia often develops much faster than we think. If you or anyone close to you experiences these signs, see a doctor immediately. Remember, early detection is key to preventing this condition from becoming fatal. Take care of you and your loved ones, as small steps like recognizing symptoms can make a big difference. This video is for educational purposes only. If this video is useful, don't forget to like and subscribe so you don't miss other videos.